Hello everyone, my name is Jad Hakim. I will be presenting alongside Jilwan Amini and Justin Coverdale. And today we will be talking about paramedics' approaches to various mental health disorders. We will present on three mental health disorders that are relevant to paramedics, and they include autism spectrum disorder, dementia, and suicidal patients. We will also cover what different techniques paramedics can use to better treat patients with these conditions. I will start by discussing autism spectrum disorder, or ASD. ASD is a lifelong neurodevelopmental disorder that is believed to have a genetic origin, although the precise cause remains unknown. It is characterized by two main components, the first being difficulty in social interaction and communication that is believed to stem from poor eye contact and delayed language development, and the second being repetitive behaviors. These behaviors can manifest as hand flapping or repetitive body movements. It can also manifest as special unusual interests in the higher end of the spectrum. Which brings me to the point that this is a spectrum disorder where different patients have different symptoms with differing severity. It is also important to note that the prevalence of autism is increasing over the decades. Now, whether this is caused by increased testing or by an actual increase in the disorder, that remains unknown. However, this is still an important point to note for paramedics and healthcare workers in general. ASD is accompanied by numerous comorbidities that are important to note for the field of paramedicine. These include sleeping disorders, self-injurious behavior, catatonia, high likelihood of seizures, gastrointestinal problems such as chronic constipation and diarrhea, as well as abdominal pain, and various psychological disorders, which can include ADHD, OCD, depression, and anxiety, and many others. There are numerous approaches and strategies that paramedics can employ to help make a patient's interaction more desirable. These include allowing repetitive behaviors to continue. Repetitive behaviors such as hand flapping should be allowed to continue because this is an anxiety coping mechanism that the patient employs. Patients should be wrapped in a blanket to make them feel secure. This is important to reduce the patient's anxiety and to prevent unpredictable hand thrashing from causing injury. Family members should be consulted about the most appropriate mode of communication with the patient. Some patients prefer verbal communication while others prefer written communication. We should minimize loud noises and bright lights during the interaction. This is very important as patients with ASD are hypersensitive to loud noises and bright lights. Things like sirens and lights should be turned off once the ambulance arrives. Try to use the patient's first name, try to ask yes or no questions, and try to give simple instructions with hand gestures to help the patient understand. And finally, avoid unpredictable touches of the patient. Every time you need to touch the patient, be sure to warn them and let them know exactly what you're doing.
How paramedics approach suicidal patients varies greatly depending on the level of training, cultural perceptions, and workplace atmosphere. Patients' behavior towards paramedics, which can sometimes be abusive in nature, causing the paramedics to resist helping the patients when they need us the most, lowering the level of care provided to patients. Recognizing suicidal patients is not always easy for paramedics, causing the approach to suicidal patients to vary greatly. Research has shown the more paramedics know, the better the outcome for our patients is. Learning how to treat patients with mental health disorders will improve our understanding of what they are going through and how us helping them fits within our scope of practice. Training to recognize that risk individuals is important because oftentimes we are the first person to encounter new patients. Being prepared for patients who are at risk often leads to better outcomes for our patients, reducing the stress on our emergency services. Community paramedics often are able to help deal with patients who are experiencing suicidal thoughts or feelings or other mental health disorders. Community paramedics are often trained to a higher level to deal with them and they deal with them more frequently than a common paramedic. They can also do wellness checks on high-risk individuals, and they do not take away from a paramedic service's ability to respond to medical emergencies. They often provide assistance to paramedics who are less adept at recognizing or treating individuals with a mental health disorder. I was on my placement a couple of weeks ago, and the community paramedic was talking about how much her job has changed over the past couple years as we begin to recognize and treat mental health disorders differently, and how the stigmatism has changed towards them, and it's not a bad thing anymore. People go through troubles and are able to get the help they need.
Hello, my name is Joe Wanamini, and I'll be presenting on working with patients with dementia. Now, dementia is a general term meant to describe patients who experience loss of memory and thinking abilities. There are multiple kinds of dementia, but Alzheimer's is the most common and most known. Dementia is a progressive disease. This means there are different levels and stages to this disease. Some patients may present with more minimal symptoms, while others present with more extreme symptoms. Though most dementia diseases like Alzheimer's cannot be cured, there are dementia-like diseases that can be cured, like side effects of medications, hypoxia, or even poisonings like some sort of drugs or some sort of exposure to heavy metals. Patients with dementia experience both cognitive and psychological symptoms. Some of the cognitive symptoms may be memory loss, difficulty finding words, difficulty reasoning or problem solving, confusion, disorientation, and even difficulty with visual and spatial abilities, such as getting lost while driving. Some of the psychological symptoms may be personality changes, anxiety, depression, agitation, and even hallucinations. When dealing with patients who have dementia, one of the biggest barriers comes in information gathering. As I said before, dementia is a progressive disease. This means not every patient you have will have these extreme symptoms, but even with minimal symptoms, it might be difficult to gather some information. For this reason, it's always best to look for a family member or a caretaker of the patient for information, such as for sample questions. If there is no family member or caretaker around, it's always best to look around for medical bracelets or medication that the patient might be taking. This may help answer some sample questions during your treatment. Your typical dementia patient will be elderly and would need a call for a fall or some sort of injury. Patients with more extreme symptoms will have trouble understanding that they're experiencing a severe trauma. They may be the one to actually call the paramedic but not know why a paramedic shows up. In cases like these, it is very important for a paramedic to understand to be compassionate, be patient, and be okay with repeating yourself multiple times. It's easy to understand that a paramedic may become agitated or even annoyed to keep repeating the same question over and over and over again, but you have to understand that these patients may forget, not understand, and have a lot of confusion about what's even happening. As a paramedic, the number one thing you want to avoid is agitating the patient. This makes the whole experience much easier if the patient is calm and the patient is being told again and again where we're going, it's okay, and to keep answering their questions. This will conclude our presentation. If you have any questions, please refer to me, Jad, or Justin. The references will be on the next slide, and thank you for watching.